Assalamu alaikum. I'm Dr. Asif Nawaz, Junior Surgical Resident and Lecturer of Anatomy. Today I'm going to make a new class or topic that is called the spleen. So here you can see there is a glandular structures, violet in color, globular, and the a important organ that present in the left upper quadrant of the abdomen, and which is around 3 ribs, which present under the 3 ribs, that is 9th, 10th, 11th. So 3 important ribs, 9th, 10th, 11th. It lies corresponding in the 9th, 10th and 11th ribs. It has some impressions and borders and surfaces. It has anterior borders and inferior borders. It has medial end. It is a medial end, and this is the lateral end. It is also called the posterior extremity, and this is called the anterior extremity. So medial and lateral one is very good to memorize. There are some impressions, and now the surface. It has 2 surfaces. One is diaphragmatic surface and one is visceral surface. The surface you are observing here is a visceral surface, and this is the diaphragmatic surface, because as it is a cross section of the diaphragm, this surface lies along the diaphragm. More visually, you can see here, this is the diaphragmatic surface, because here the diaphragm is the only organ that lies here, and this is the visceral surface. You can see some impressions here, the gastric impression, this is the renal impression, and this is the colic impression, because with this impression the viscera, stomach, and the left-sided kidney and the splenic flexure of the colon or the left colic plexure are situated or related here. And in the center of the spleen you can see some vascular structures. Some are vein and artery. It is correspondingly called splenic vein and splenic artery. So splenic artery, the celiac trunk has 3 arterial branches. One is splenic artery, one is left gastric artery, and one is common hepatic artery. So splenic artery, which is derived from celiac trunk, just lies behind the stomach and ultimately supply to the spleen. colic area, colic viscera, that means left colic flexure or the splenic flexure also called, because this area which lies here as a colic impression. And here you can see the renal impression. Here the kidney, so the anterior surface of the kidney lies here, part of the anterior surface and the part of the posterior surface also are invaginated through these impressions. So here the part of the left kidney present with the spatial ligament that is called the lino-renal ligament. So hilum of the spleen will attach with the anterior surface of the kidney with the lino-renal ligament, because this is called renal. So here is the name renal, means a part of the ligament which is attached with the anterior surface of the kidney. And you can see the spleen and present here with a ligament that is called splenico-colic ligament. And the part of the diaphragm, that is, this is the diaphragm, the diaphragmatic muscles, and so part of the diaphragm also connected to this colon, that means phrenico-colic ligament. So these ligaments are so important, and the hilum of the spleen also attached with the tail of the pancreas to pancreatico-splenic ligament. So pancreatico means the ligament's one end is connected with the tail of pancreas, another one with the spleen. That's why the name is called the pancreatico-splenic lymph nodes. And this is the hilum. This is the hilum by which the hilar vessels, that is artery, splenic artery and vein, is connected or comes in and out through the spleen. So the spleen is very important organ for immunogenesis. That means it can produce T and B lymphocyte. It can produce lymphocyte and gives protection to the body by producing B lymphocyte, T lymphocyte. And there's another option that in the intrauterine period, this spleen can produce erythrocyte, that means red blood cell. But in the later in the life, when in the adult life, the spleen act as a reticuloendothelial system. That means spleen can destruct RBC or erythrocyte when the time comes. That means after 120 days, each erythrocyte will destroyed by the spleen, because spleen has a mononuclear phagocytic cell that can destroy the defective or aged RBC. So there are some micro functions of the kidney, the spleen has both immunogenesis and also the reticuloendothelial functions. So spleen can do both functions in the same time. So how they occurs, let's discuss. Yes, this is a splenic parenchyma. That means the histological structure of the spleen. Okay, so if there is a cross section, if I make a cross section of the spleen, how it look like? It will look like this. You can see this is the vein, splenic vein, and the part of the splenic artery and their vast branches. Because when there is a cut section of the spleen, what we can see? We can see some red area and some white areas. And red areas is called the red pulps, the reading parts, the red pulps. Okay, it contains some arterial system and some white area in between there. So surrounding the blood vessels, you can see some white areas. These are called the white pulp. So white pulp and the red pulp has special characteristic features, their locations, their connections, and their functions also. And the both spleen is surrounded by two layers. One is serous layer from the outside, which is lying with the peritoneum, and other is inner fibroelastic layer. So fibroelastic layer is internally folded, because you can see some folded internally. This is fold, fold, fold. So these folds is called the trabeculae. So this trabeculae contains the white and red pulp in the same place and united to form a network of functions that can produce both immunogenesis, can produce T cell and B cell of the lymphocyte, and also the reticuloendothelial system that can destroy RBC and also can produce platelet. Okay, so here this is called the splenic hilum. Splenic hilum contains splenic artery and their branches, and splenic vein and their draining areas. Okay, ultimately what are the things? You can say this is the splenic hilum. So when this splenic artery enters into the parenchyma, it is called the branch of splenic artery. That means this is a splenic artery. When it introduced into the spleen, it will branched as multiple arterioles. So these are the arterioles of the spleen, that is central, and these are the arterioles, and this is the central arteriole. Okay, when the splenic artery first continues with as a central arterioles, and central arterioles has a different branches. Okay, these are called the peninsular artery. Okay, these arteries become single or end artery. It has no other branches surroundingly, so this is called an end arteries. So it is in case of spleen, these arteries are called the splenic peninsular vessels. Okay, and you can see the surrounding the artery there are a bluish area, bluish white areas. Okay, and containing some blood cells. There are some cells and the bluish area that surrounding the arterioles. It is called the periarteriolar lymphatic sheath. That means these are the lymphatic sheath which is surrounding the periarterial area. So periarterial lymphatic sheath, this is called. So it can produce a special cell, that is T cell. Periarteriolar lymphatic sheath, this area can produce T cell, and into the periarteriolar area there are some germinal centers. Okay, it is a center of the sheath. It can produce special kind of follicles. This can produce B lymphocyte. So germinal center, periarteriolar lymphatic sheaths, and the antigen presenting cell. So there are special kind of cells, those can present as an antigen. How? Because when blood carry a virus or bacteria or other disease substances, this antigen presenting cell will engulf the organelles, that means virus and bacteria, and recognize it as a harmful chemical agent or toxic agent for the body, and it will go straight through the B lymphocyte and present it as a harmful area. Then B cell will produce antibody, and antibody will secrete directly through the marginal sinus, directly to the sinus, and ultimately these sinus, then antibody will carry it out through the penicillin artery, and here it is a open vascular channels or communications. That's why penicillin artery will directly goes through the intervascular area. It contains some venous sinuses, so there are many venous sinuses here, okay, in the white areas. That venous sinus will collecting as a single sinusoids, okay. So all the venous sinus ultimately drain into the sinusoids and forms a splenic vein, and ultimately it will go to the portal system. So this is how the B lymphocyte works. So this is how the lymphocyte works. The protection of the body will be produced by this, but if a direct virus or bacteria came and this is the second time, is the same virus or same bacteria will come into the second times, then the periarterial lymphatic sheath can produce T lymphocyte, or to the T cells. That T cell will directly kill the organisms inside the arterial channels by the T cell. So T cell or the natural killer cell will wait for the virus and bacteria to kill and protect the body by the functions. And now how the reticuloendothelial system occurs. That the periarterial lymphatic sheath, the germinal centers, and the antigen presenting cells, these three are together called the white pulp, okay. So this white pulp will produce immunogenesis, and there are some red pulps, that means venous sinuses, penicillin artery, ellipsoids, and the venous sinusoids. So these together call the red pulps. When artery comes to here, the intersinusoidal area, that defective or aged RBC cannot enter to the venous sinus, or the venous sinus can have a fenestration, a multiple fenestration, but the defective RBC or the aged RBC cannot pass through the fenestration and ultimately died here, because this splenic parenchyma has a dendritic cells. Dendritic cells is one of the important mononuclear phagocytic cell. Phagocytic cell means the cell which can kill the unwanted substance of the body. So there are many mononuclear phagocytic cell present in the body, especially in case of spleen. The name of the mononuclear phagocytic cell is called the dendritic cell. So dendritic cell will phagocytose the RBC that are defective or that are aged. So that will be killed here in the venous sinuses. So you can see some marginal venous sinus, virginal sinuses, and some open circulation. Some artery will directly through the closed circulation from the marginal sinus directly into the venous sinus, and some are through the penicillin artery or and the in the open circulation goes to the venous sinuses, and ultimately the selected RBC or the defectless RBC can cross through the fenestration and ultimately can access to the splenic vein. So these circulation is very important for the exams, and you must work out to draw or write down the drawing of the pictures, and you must explain the mechanisms, how red pulp works and how white pulp works, and you must write down the white areas and identify the white pulps and the red pulps and their functions. Okay, Now spleen can be enlarged. Spleen itself can become enlarged in some disease condition. It is called the splenomegaly. Megaly means enlargement. Spleen become enlarged because in case of hematological diseases like thalassemia, like sickle cell anemia, like portal hypertension, the spleen becomes enlarged. In some infectious condition like hemophilus, in some condition like typhoid, there are some other conditions where the spleen can enlarge. It is called the splenomegaly. So there are some surgeries, that is spleen can be resected if there is any injury to the splenic hilum. So it is a very highly vascular organ, so we cannot stop bleeding if any injury occurs in this hilum or injury to the spleen. Okay, that spleen can be ruptured and that can be devastating, because ruptured spleen is very emergency condition. Patient can die within an hour due to the hemoperitoneum and the hypotension and hemorrhage. So the spleen can be resected through blocking of these vessels and ultimately cut down all the ligaments, and the spleen can be resected, because a huge spleen can easily traumatized or easily break down and forms a ruptured spleen. So a splenectomy is one of the important surgical condition. Sometimes surgeons are encountered splenectomy because he or she have to make the decisions to make a splenectomy during other operations or spleen itself. Thanks for watching today's video. So I hope you understand the relationship that present surrounding the spleen and their vascular structures, and importantly the splenic internal mechanisms of red pulp and white pulp, because spleen is very important organ for immunogenesis, or it can produce immunity or give protection to the body, and also it acts as a reticuloendothelial system. That means it can wash out the aged RBC or defected RBC and produce a new one, and it can also helps in storing of platelet, that is very important for coagulation of blood. If any vascular injury, if any occurs, traumatized epithelium or others cut injury, that bleeding can be stopped by platelet, because platelet has some coagulative features. So spleen will maintain this count of the platelet. Thank you for observing today's lecture. Thank you.